Carly Rumsky. I'm a certified occupational therapist assistant.
My name's Erica Kuhart. I'm a registered occupational therapist.
And my name's Carrie Gaber. I'm also a registered occupational therapist.
So this month is OT month, Occupational Therapy Month. So we wanted to just explain to you what our profession is and what we do within it, and how we use adaptive equipment, wheelchairs, everything else, so that our patients are able to be as independent as possible and as safe as possible. So occupational therapy is a very unique type of therapy. We help people with their strength, endurance, activity tolerance, things like that, but we also help people do the things that they need to learn to do every single day at home, such as getting dressed, going to the bathroom, showering, cooking, cleaning, self-feeding, and everything like that. So today we have some adaptive equipment that we're going to demonstrate on how to use that we do with our clients every day.
The first one we'll do is a sock aid. So if a patient has difficulty putting their own socks on, this equipment helps them to be able to do that as independent as possible. So here you just have a bigger hospital sock. Pull it tightly here. So if someone has difficulty reaching over and bending down to their feet, they use this device to throw it out in front of them, put their foot in it, and then they just pull on up. And sometimes they just have to fix the sock a little bit. That just helps them to be able to do some lower body pressing with the use of adaptive equipment. Another device would be a reacher. So with this would help put on pants. If you had a pants, and again, if you couldn't reach down low enough to put your pants on yourself, you just take it in the front or back of the pants, throw them out in front of you just like you did the sock aid, and then you'd help by pulling up the pants up your leg. Also, several people use this to reach things out of support, where if they're in their wheelchair and they can't reach it themselves, then they use it to grab it and retrieve items that they can't reach independently. So the reacher can be used for several different things. And then we have a shoe horn. So this also helps put on shoes. So if you have difficulty putting shoes on, you put this in the back of your shoe, slide your foot down, and you're good to go. So just a few of the adaptive equipment we use for some of our patients for dressing.
We also help with self-feeding, making sure people are able to feed themselves properly and safely. We have here a weighted and built-up knife. The weighted part is for someone maybe with increased tremors, and the built-up is just for people with like decreased fine motor skills that might need help holding things. And it's just an ability to be able to feed yourself a little bit better, which is obviously a part of everyday life. So we also get adaptive equipment for that sort of thing, so that they're able to be as independent as possible. And we also do a lot with wheelchairs, wheelchair safety and mobility. So Carrie's going to explain some of our wheelchair equipment.
So we can work with patients to make them have proper body positioning in their wheelchair to increase their safety. There's some different kinds of cushions that we can use. This one here in the wheelchair is a wedge cushion, so it's thicker in the front and skinnier in the back, so that's going to prevent them from sliding out of their wheelchair. There are different things that we can add to help them stay upright, like this lateral support. So if somebody's leaning over to the right or to the left, we can put that there to give them some more support for that proper positioning to help them participate in their daily activities. There's other kinds of cushions too, like anti-thrust and roho cushions. So the anti-thrust will, if somebody's sliding out this way in their chair, it kind of prevents that. And roho is filled with air, so if somebody has some wounds on their bottom, it gives them some more cushion. Along with the feeding, we also have different types of cups that will increase independence with residents. There's a two-handled Floetrol cup, so it has two handles on the side, and it's like a sippy cup to prevent spills, and gives them handles to hold on to make it a little easier.
Yeah, so we hope you learned some stuff today about occupational therapy and the services we provide here through Premier Therapy at the DuBois Nursing Home